Listen, cancer can be scary, but did you know you can take some actions to stay healthy? Hi, I'm Dr. Patricia Kelly Marsh, CEO of Ask Me Your MD. Cancer is the second most common cause of death in the U.S. Even though it's devastating, there are some things that you can do to stay healthy. I'm going to share with you the screenings that you should get for the 6 most common cancers in the United States. Number 1, colon cancer, or should I say number 2? You get it. But in all seriousness, when you turn 45 years old, make sure you get the screening for colon cancer, called a colonoscopy. What's sad is that Black people are 20% more likely to get colon cancer. And the chances of you dying from colon cancer actually doubles if you're Black in the United States. You might ask, now how do I get screened? Well, there are a few kinds of tests that we do. One screening test that I mentioned was the colonoscopy, or you can do a poop card. Now, a colonoscopy, it only has to be done every 10 years. And it's usually done in a GI doctor's office or a hospital. They take a little small camera, they stick it up, and they go all around your colon. Now you have to do some preparation for this that could be a little cumbersome, but it's worth it because you only do it once every 10 years. Number 2, breast cancer. Now, guys, don't check out because men develop breast cancer too, but these are our recommendations for women. Even though most women are diagnosed after the age of 50 for breast cancer, we are finding out more and more that younger women have developed breast cancer, especially us Black women. It's important that we get our mammogram every year. And mammogram is just an X-ray of your breasts. According to the American Cancer Society, between the ages of 40 and 44, you have an option of getting your mammogram every year. But talk to your doctor. See if you have some of these risk factors that include a family member with breast cancer or having a gene related to breast cancer. Number 3, cervical cancer. Now, cervical cancer is caused by a virus called the human papillomavirus, or HPV. With this cancer, you can get a pap smear, and we have actually taken down the number of times that you have to get a pap smear because cervical cancer does not grow that quickly. So if you're between the age of 21 years old to 29 years old, you get a pap smear every 3 years. But if you're older, age 30 to 65, you can get your pap smear done every 5 years. But we do test for that HPV virus just to make sure. Now, if you haven't gotten vaccinated for HPV, you should consider it. It will prevent you from getting the most common causes to cervical cancer. Now, we stopped testing you at age 65, so you can retire from work and pap smears if you've always had a normal pap smear. Number 4, lung cancer. We test lung cancer by doing a CT scan. That is a high-definition X-ray of your lungs. So who should get screened for lung cancer, you might ask? Well, ask yourself these questions. Am I 50 years old to 80 years old? Have I smoked a pack a day for 20 years? Do I smoke cigarettes or did I quit within the last 15 years? If you said yes to any of those questions, then absolutely you should get the low-dose CT scan once a year to get screened for lung cancer. To lower your risk of lung cancer, though, you should cut back or stop smoking. Also, for those of us who don't smoke, we should avoid secondhand smoke because secondhand smoke can cause lung cancer. Number 5, prostate cancer. Now, prostate cancer has been very going up and up and up in Black men. So take very close listen to this. We test prostate cancer in 2 ways. There's a blood test called a prostate antigen test, or we do an exam in our clinics. And you know that a lot of the fellas, don't like that exam, but it can truly save lives. For the direct rectal exam of the prostate, we just go in, feel around, and then remove our finger. So it's in, out, very quick, and very fast. So it won't be, uncomfortable for you. We start testing actually at the age of 40. And that's because we've missed a lot of prostate exams. Because us Black men, we don't go into the doctor so often. So if you're a Black man and you're listening to this video, make sure you start getting tested at age 40. And we test all the way up to age 65. Those are the 5 cancers that we have gone through. There is another cancer that I like to mention because it disproportionately affects Black people, and that is called multiple myeloma. This is a blood cancer. Now, I know this is a lot of information already, but getting your annual wellness exam and making sure that we test your blood can prevent you and us from missing a diagnosis of multiple myeloma. I hope all of this information was helpful. I want you to share this video and join the Now Included community for more information and resources that can help you stay healthy. And if you have any other follow-up questions, you can always go to askmeyourmd.com.